turnout so late in conference. We've done 8 events now, and I would say we've saved the best till now. So thank you very much for coming, absolutely everybody, and obviously thank you very much to our panel. I'm going to introduce the panel one by one as you're about to speak. I know it interrupts the flow, but if I tell you what everyone does, then by the time you get to Julian, you've completely forgotten who he is. You'll think he's a Labour candidate for somewhere in Wales or something. So I think the best thing is if we just do that. I'm Samantha Callan, and I head up the Centre for Social Justice's work on families, mental health, early years. And one thing that really struck me when I started to look at adult mental health with any kind of degree of rigour was the huge prevalence of black and minority ethnic adults in the hospital population, frankly dying in custody. There's this awful phrase, they are overrepresented in statistics, which I completely agree, but it can numb the senses and we can just forget how bleak that is for people who are actually in those statistics. So let me just give you some of those, and then I'm going to give you a couple of quotes from mothers of young black men who ended up in the mental health system. So very quickly, BME adults 3 times more likely to experience severe mental illness and to be hospitalised, and 44% more likely to be detained against their will under the Mental Health Act, so losing their liberty basically. They're also 40% more likely than white people to be turned away when they ask for help from mental health services and from their GPs. So anyone who's got a kind of early intervention mindset will know that those two things are very connected. If you don't get help early, you're more likely to be getting help in a crisis. Okay, secondly, perhaps more concerningly, that they are 40 to 60% more likely to get help finally from mental health services through contact with the criminal justice system. And they're twice as likely to be held in police cells at a time of crisis than in a clinical setting such as an A&E department or GP surgery or somewhere even in the community, which I think we need to use far more of. Now, the last government, I'm really hoping we're going to get Diane and Andy for some time during the morning, the afternoon rather. I think it is really worth saying that the last government did finally begin to prioritise this issue. They set up something called the Delivering Race Equality Agenda, began to collect statistics. It wasn't perfect, there's an awful lot of learning, there's a sense that that learning is kind of fizzling away, that we're not kind of capitalising on it. And I'm going to issue if we see him, I really want to issue a challenge to Andy on this, because I think he's a real honest broker in the area of mental health. But the stakes are that people aren't getting the help they need when they need it, and this can end up, it can result in them losing their liberty, their freedom, and their lives, and if not that, just their potential to flourish. So really key issues. Just want to finish my opening comments with a couple of quotes from African Caribbean mothers, as I said earlier. So their sons become caught up in the acute mental health system, and they've been helped by third sector organisations who've been advocates on their behalf. And they've said, one lady said, I made one of the biggest mistakes of my life when I rushed my son to hospital, finding he'd been trapped in the wilderness. He went in expecting to come out. When they catch a bird in the wilderness, they mend its wings so it can fly. They didn't do that for my son. So utterly poignant. And then a second mum with a teenage lad who went to hospital, she said, when he went into hospital, they didn't ask us or him nothing. They just gave him drugs. They made him full. He just wanted some backup. So that's the kind of, they're the headlines. They're the kind of painting the picture as to why things need to improve. And we've been doing a lot of work at the CSJ on improving systems, better personalisation, tackling deaths in custody. How do we do that? So I don't want to say any more, but I'm going to just hand over now to Sarah Darkin, who's a great friend to the Centre for Social Justice. Her organisation is a member of the Alliance. She's the director for parenting at Family Links. And she's taken a keen interest personally in developing services for Muslim parents. Works in collaboration with the UK Islamic Mission to promote emotional and mental health of parents and children. So really getting at the sharp end for the youngest members of society. So I'm going to hand over to Sarah. Thank you, Sarah.
Thank you. Yes, very sad and telling sort of figures that Sam's coming up with there, and I think we are working very much at the early intervention, early identification and sort of prevention end, I suppose. I should just say, you know, CSJ have been great support to us, but also this work couldn't have actually happened without the support of Lankelly, so we're incredibly privileged to be sitting on the same panel, I suppose, as CSJ and Lankelly as well. So I'm very specifically going to talk about Family Link's work with Pakistani parents, and it's work that's really been pioneered by Arifa Naeem, and if anybody wants to catch Arifa afterwards, I may be happy to speak with them. Because we have a parenting programme which is based around emotional health and the promotion of emotional health and mental health for parents and children. And Arifa began by delivering that in a mosque in Slough, and recognised that there was a big confusion really between religious values and cultural values. And as a result of that piece of work, we've now extended the programme so that we have incorporated Islamic values. This is a royal we, actually, I have to say. Arifa and another Islamic counsellor have incorporated Islamic values into our parenting programme, and it's a very exciting piece of work. So I suppose what we see amongst parents and what we hear about, particularly for this Pakistani community, mental health problems are stigmatising for everybody, but they're particularly stigmatising perhaps in this community. Men don't want to disclose that they have a mental health problem for fear of the impact on their employment, bringing shame, bringing the family or the community into disrepute. So there may be a tendency not to access conventional services, but to bring in medicine from Pakistan or to get it over the internet. For quite a few parents, and certainly for some of the women, there may be a view that actually suffering is perhaps the will of Allah, that it may bring them closer to Allah to suffer. And therefore they may be depressed but feel powerless really to change that situation or to access anybody that they feel is really going to understand where they're coming from. So they can be very reluctant to seek help. So what we've done by incorporating Islamic values into our regular programme is to actually engage with those parents who aren't accessing other services. Now obviously lots of Muslim parents come to anything we offer throughout the country, and that's great, that's fine. And we will have a mixture of parents of all different groups, no problem. But for some parents they are reluctant to trust the service or the workers providing it. And so by making it religiously and culturally relevant, it's been possible to challenge some of the cultural views of family relationships and some of the taboo around talking about mental and emotional health problems. So, for example, we would talk about managing difficult feelings. What do we do with difficult feelings? And where it may have been considered to be a virtue to suppress those difficult feelings, by actually using hadiths and excerpts from the Quran, it's been possible to help parents see actually it is okay to talk about those feelings and to get help. And it could be the first step, really, for people to begin to access help. So we have now trained over 40 volunteers from the UK Islamic Mission who are now running groups in mosques across the country, literally from the north to the south, all over, and London as well, reaching maybe 400 parents a year. It's not unusual for there to be disclosures of past or current abuse, physical abuse and sexual abuse. And coming to the group and being able to feel safe enough and be understood within a cultural and religious context has enabled people to then go on and access other help. I think our plea would be for more culturally and religiously informed and relevant services, because often then when they do want to go on and access help, just as Sam's saying, they don't feel that they're going to be understood and may not then make that step until things are in crisis and then they end up being hospitalised or whatever. I think for any of us to seek help, we need to feel we're going to be understood, don't we? We need need to feel that somebody's going to understand our external world, you know, our family life, our culture, our religion, our sort of experience, but also our internal world, our sort of thoughts and feelings and needs and motivations. And I think for many adults, incorporating religious values within the service has meant much more profound change than would ever have happened just by offering the service without that religious element to it.
Thank you so much, Sarah. And I'm going to hand over now to Malik Gul. He's the director of Wandsworth's Community Empowerment Network. Spent 30 years in the field getting communities to work together, so incredible track record. And working right now with the local clinical commissioning groups, BME Mental Health Inequalities Working Party. Such a mouthful. Anything in mental health, I find, it's got this enormous long title, but he's worthy of his title because we really enjoy working with Malik. So over to you, Malik.
Thank you. Thank you. And just to follow Sarah, can I also thank Callie Chase, who has been one of the supporters of our organisation, and I won't steal Julian's thunder because he's got some very interesting things to say. This being a Labour audience, how many of us remember neighbourhood renewal? Yeah, neighbourhood renewal.
Yeah.
Things can only get better. Yeah, 1998. What was very interesting about that, I mean, I work for a community empowerment network, is there was 88 community empowerment networks set up across the country, and the whole idea of neighbourhood renewal and community empowerment networks was to get local groups, not voluntary sector organisations, local groups, churches, mosques, temples, really grassroots organisations to participate in decision making. It's a pity Andy isn't here, because what I wanted to say, that if you read the foreword, it said a 20-year vision, and the goalposts were moved after 4 or 5 years. But we've kept going in Wandsworth, where the last community empowerment network is still standing. And I'll tell you what we've learned 13 years down the road is the enormous amount of social capital that is held inside community groups. And just to describe some of the work we've done, I mean, what's happened over the last 10 to 15 years, especially with this audit culture which has come about, and I must say Labour then kind of took it to an nth degree with the whole kind of deliverology unit, delivery unit inside, where everything became about management and counting. So our mental health services and the NHS, now the CCG, in fact their accounting mechanisms are not down to communities, their accounting mechanisms are up to Whitehall, and regardless what is said in a local area about nothing about us without us, local this, local that, the compliance regime is so strict from the centre that they can't do anything but tick boxes back up. So in the meantime, what has been happening is we've got community groups who have been struggling, really. You heard Samantha talk about the overrepresentation of mental health and everything else that goes along with it, that actually doesn't have an ear inside the public agencies. They're just not responsive to what is going on. But yet these organisations are so well connected. I know our friends here from the mosque. I mean, I speak as a Muslim myself, and I speak as a Pakistani Muslim. And within our communities, there's things like Bradri networks, and those from the Muslim community will know what I'm talking about, who are essentially kinship networks. People who know people who know people who know people inside communities. And people inside, let's say, black pastoral communities. Again, very, very interesting pastoral networks. People who know people who are connected to other people. And what we've discovered is that these worlds actually exist in parallel to mainstream society. They're not connected in any significant way at all. I was here the other day with Samantha, John Cruddas talked about One Nation. Maurice Glassman last night, again, had similar kind of conversations. And all of this kind of interesting analysis, but no real how do you join up these very interesting social networks and the main agencies. My colleague here talked about the Muslim networks. I mean, we're doing some very interesting work with black pastors. And very quickly, Samantha, I'll just go to a story about how we developed this project. Mental health services tell us black communities present themselves late. I mean, we know this. You have a white person with schizophrenia and a black person with schizophrenia. White person is more likely to get services earlier and then have a normal path through life, marriage, family, so on and so forth. Black person presents late. And by the time they get into services, things very acute, things very difficult. I mean, these are the things which we know. Yet the black pastors were saying to us, well, hold on. we're often the first person that's called. When things are going on inside community, because the pastor's not just religious leader, he's also friend and confidant and all the other stuff, yet absolutely no knowledge at all of mental health services, nothing, completely divorced from them. Labelled as a faith leader, therefore you can go in the faith box, somewhere over there, right of the voluntary sector, and absolutely no connection at all. So we managed to bring together a group of black Pentecostal leaders in Wandsworth, and over a period of time, worked with them, and they formed a black pastors and family care network. And last year they started to train in systemic family therapy. Already completed the first year, about to do the second year. By the time they finish the third year, they will be as equipped as the people that are employed by the Mental Health Trust. So all of a sudden what you now have black leaders inside their own communities who are right at the front line of that holy grail, the redesign of pathways. Because at the moment, the only pathway into mental health services, as we know, is GP, A&E, and the police. Once you start to redesign the pathways inside these community organisations, right at the front line of public service delivery, you then start to redefine what a interface looks like with communities. And we are now beginning, similarly, in October this year, to start to train imams in and around southwest London in exactly the same thing. So you can then imagine what a future scenario looks like, where you have community leaders in their own social networks embedded inside communities. Biggest problem we have, absolutely, I mean, southwest London and St George's Mental Health Trust funders, so I can't slag them off too much, but the family therapy unit, those of us who work in mental health will know, that is one clinical team out of 46 clinical teams inside the Mental Health Trust that sits within a clinical community environment that is so overburdened. How do you get the good practice from one permeating the other? Because essentially you're talking about exactly the same communities. The mosque is the mosque and the black church is the black church, yet they are pressured by about 50 different conversations. Work with us on housing, work with us on this, but essentially it's the same community. So the issue is about how do you get intelligence out into the communities. So we're doing good work. I mean, the idea with, Andy Burnham and others, 2015 is about to come, let's get some intelligence into the system.
Fantastic, thank you so much. Well, you guys have already slightly stolen my thunder, which I don't mind at all, in thanking Julian Corner and Kelly Chase for hosting the event. We're an independent think tank. We work across all the main parties. We've been at all the main party conferences with this event, because that's the kind of investment we as a think tank want to make in this issue. And it's in no small part due to Julian's personal kind of challenge to us as an organisation. Look, you've written this report. What are you going to do to help make it happen, to really change the game for mental health sufferers in BME communities? So I think in some ways he needs no introduction, because so many people seem to know Julian already, but I will just have a stab at introducing from his glittering CV. He's been Chief Executive of the Criminal Justice and Mental Health charity, the Revolving Doors Agency. But he has got a darker history in the civil service in the Home Office. But also he was in the Department for Education and Employment and in the Social Exclusion Unit. And again, huge overlaps with other aspects of our work. Whilst he was in the Social Exclusion Unit, he led its report on reducing reoffending by ex-prisoners that led to the creation of again, another long title, the National Reducing Reoffending Strategy. So what's so great about Julian is he really knows how things work from the inside, and he's using all that knowledge to provoke us on the outside. So thank you, Julian.
Golly. Thank you very much. And thanks to the Centre for Social Justice for taking up that challenge. It's easy to throw down challenges as long as we don't have to pick them up ourselves. So Kelly Chase, people ask me this, so I'll tell you, even if you're not interested. We're an independent funder. Our funding came from a couple of business colleagues about 50 years ago who left an endowment, and 50 years later we're still spending it. So we are an organisation which is exclusively focused on the extreme margins of society, typically where social problems straddle the responsibility of multiple agencies, where organisations are trying to grapple with how do you provide decent support to very vulnerable people when the system militates against that. And often those organisations come to us for independent money because they can't get the money to do the work that they know they need to do from mainstream sources. So our question is, well, okay, well we can give you 3 years worth of money, but then what? And it's interesting looking at that kind of activity. What you see on the margins of society is, by which I mean where people are precariously hanging on, is that the systems which are ostensibly there to help them are often actually exacerbating the troubles that they're facing, and that it's actually quite hard to distinguish what's them and what's the system, because it's all such a mess. And if you look a bit closer, you realise that systems which the layperson might think are there to support people and help people are actually there to manage and contain their risk. Very little help, genuine help is being offered to people, let alone anything transformative. And black and minority ethnic mental health is a classic example of this. It's a problem that in many ways is as much generated by the system, by its cultures, by its structures, as it is by the issues faced by the people themselves. And we started funding in this area really at the start of delivering race equality, because we saw an opportunity there. We had a government that was determined to do something about this, and we saw an opportunity to really boost the ability of the community to respond to a central initiative. And our focus was on community-led organisations, particularly BME-led organisations, who could provide culturally appropriate, trusted services. Why did we do that? Well, as has been said already, particularly young black men tend to access support, if they choose to do that at all, very, very late in their journey through to severe mental illness. And by that point, the support tends to be coercive. All the evidence suggests that if that support can come through trusted community routes much earlier, then that can be a far better, more positive experience, but it can also be, frankly, a much cheaper thing for society to pay for. And delivering race equality, just to offer my own little bit of history, was something that got rolled out in quite a hurry, and typically for central government, rather than attempting a quite nuanced problem-solving, asset-based approach. An army of community development workers were sent out there or got created across the country, whose job it was to somehow bridge between the community and public services. And that was quite a typical New Labour response to a problem. Find a problem, get a coordinator, get the coordinator to join everything up, and somehow a solution will knit itself together. And also, just as typically, these coordinators weren't given any real power. So actually very little got changed. And what we found was that the money didn't filter through to the community, to community groups. So our bit of money never joined onto the mainstream money, and these organisations now, I would say, are worse off than ever before. Come the austerity, many of them were the first to fall. So what are our conclusions from that experience? Well, firstly, government strategies tend to gravitate towards action that government can count and measure, that is more formalised, more professionalised, and in this case it's most obviously activity that takes place within the medical profession. Inevitably, this skews funding away from less understandable, less formal, less containable organisations that exist, providing the glue within our community, as Malik has talked about. And then this means that the social capital, so even when you've got a strategy that is pumping hundreds of millions of pounds into this, actually what's simultaneously happening is social capital is drying up. And as that dries up, the figures get worse. They either got worse or didn't change under delivering race equality, the statistics that Samantha began with. And so all of the capacity then falls, all of the challenge and demand falls back into the crisis end services, and you end up with this incredibly stuck situation with everybody saying nothing works. We're trying out all that we can and nothing works. So where does that leave us? Well, firstly, I think it's no accident that this has happened in the field of, that this has happened to BME communities. And so much of that is about power and about accountability. And nobody loses their job when the data doesn't shift on poor outcomes for BME communities within the mental health system. I'm not saying necessarily that people should lose their jobs, but nobody feels the pain and the pressure of that within the system. So we need mechanisms within government, we need mechanisms out of government that hold people to account for the fact this isn't shifting. The second thing is that we need to build the credibility of community-based support and interventions here. And by which I mean an evidence base that captures what really matters, which is trust, relationships, empowerment. Again, these are things that very rarely get counted by the centre, but these are the things that actually make a difference. And we also need to explore models for how money can be released from high-end parts of the system to the community. We're stuck in this situation where the same commissioner has to pay for both, but their imperative is to deal with high-end needs. And we have mechanisms like social impact bonds, which were initially trialled by this party, most obviously in Peterborough prison, that can provide some mechanisms for achieving that. And then finally, and Samantha is a strong advocate of this, tying together all of the latest thinking that we have on things like recovery and personalisation, and working out how that works across diverse communities. And the final thing that I want to say is that the thing that most typically gets said to me about this issue is that it's very complex. You know, this is a very complex issue. People shake their heads. And it's really striking how complexity is cited as a barrier to change when the beneficiaries of change are disempowered, voiceless communities. We don't tend to find complexity being an issue when it affects the majority. So we're determined to press on with this and to work with our colleagues and to get this agenda back on track, really. We've got an alliance growing with several organisations. It's a little bit like pushing a boulder up a hill, but it's worth it. Yeah. So if anybody wants to get involved with us, then please let us know. Thank you.
Thank you.